Now, life expectancy in South Africa has dropped from 65.5 to 62 years. Social Development Minister and the department blames this on COVID-19. The death rate has also increased from 8.7 to 11.6% per 1,000 people. Let's discuss this further now with Diego Iturralde from the Stats SA. Thank you very much, sir, for your time. Now, obviously, these findings were made during the period 2019 to 2020, am I correct? Or is it still the case even in 2021?
These findings are based on the media population estimates, which were released in July of 2021, and they cover the period of the 1st of July 2020 to the 30th of June 2021.
Now, obviously, it is correct for the Social Development Department to blame COVID-19, right? I, for instance, don't know a single family in my life that has not lost somebody to COVID-19.
It is probably plausible to attribute the drop in life expectancy to COVID-19. It's the main thing that is different between the 20 to 21 period compared to the 19 to 20 period. But until we process the death certificates for the years 2020 and 2021, which is when COVID-19 really impacted South Africa, we won't know with certainty the extent to which that drop in life expectancy was attributed to COVID-19. But in all likelihood, given the change in mortality profiles in these 2 years, it's most likely that it can be attributed to COVID-19.
So this has affected, obviously, mortality. What about childbirth? We saw in that same briefing by the BRICS nations, China saying that it's realized, that there's less people who want to get pregnant because they're afraid about what the vaccines will do to the fetus, etc. Are we seeing the same trend in South Africa? Are we seeing a drop in the number of people giving birth?
Well, as a coincidence, the International Population Conference is taking place this week in a virtual format, and just yesterday I was listening to a conversation of various countries around the world discussing exactly that. What seems to be the case is that in poorer communities, due to lack of access to contraceptives, there seems to be a boost in births, but in the wealthier communities, the opposite seems to be the case. That people are either maintaining their fertility levels or postponing childbirth to later on. Data on this is still very inconclusive. South Africa released its own registered live births earlier this year, and we reported a very similar number of births for 2020. So I think at this point in time, it's very inconclusive, and we probably need to have a look at this a lot closer. There's also not been much data in terms of the impact of the vaccine on pregnant mothers, particularly pregnant mothers who are hesitant around taking the vaccine. So that's certainly an impact that needs to be looked at to see whether there are pregnant women who have that view that they would rather postpone it because they are afraid of the impact of the vaccine on their unborn child.
What else did Stats SA find that could have resulted in COVID-19, that could have resulted from COVID-19, rather, the past few months that we've had? What else affected your findings as Stats SA?
Well, when we calculate life expectancy, we're not specifically concerned about a cause of a particular death. We are concerned about all deaths. So I think one thing that stood out was that in this 2020 to 2021 period, that the number of deaths that were estimated were equivalent to the number of deaths in 2006 when we were at the peak of the HIV epidemic. This resulted in not only life expectancy dropping by 3.5 years overall, But also, as you mentioned earlier, that crude rate increased from 8.7 to 11.6 deaths per 1,000 people in 1 year, which is really a dramatic finding. But I think from a mortality perspective, that was quite prevalent. But if we also look at from a population growth perspective across all ages, we noticed that the population growth rate for this last year dropped from 1.37% to 1.01%. And most notably amongst the elderly, amongst those over the age of 60, it dropped from 2.9% the year before to 1.53%, so almost halved for the elderly population, which I think is a further striking finding.